Hi everyone, my name is Rosalind Panda and I welcome you all to today's special live show. Today is 10th October 2023, which we all celebrate as World's Mental Health Day. Basically, we always emphasize more on physical health, but we never consider mental health as a very important factor. But do you know that it is interlinked? And if you are not taking proper care of your mental health, then no matter what, you will always face difficulties in your physical health. So, how to take care of your mental health? How to be fit in your mental health? We can all discuss today with, we today have counseling psychologist Dr. Shashimani Mishra. Madam, आपको हमारे लाइव शो रे मो वेलकम करछि. So ma'am, before going into our questions, I am curious to know, and I want the audience to also know, the difference between health, mental health and mental illness.
Yes, that's a very important and significant question because people are still very confused and they use these terms interchangeably, health, mental health and mental illness. So as we all know that WHO has given a definition of health which states that health is an individual's physical, social and mental well-being, and recently spirituality was also added to the definition. Mental health is an individual's caliber, capacity to deal effectively with the environment, to deal effectively with the life stresses, and to contribute to the society, to be more productive in his working environment. Mental health is all about an individual's emotions, behavior, thoughts, his perception, his awareness about the world, how does he deal with the stressful situation, how he is contributing to the society as a whole. On the other hand, mental illness is an illness that affects the way we think, behave and interact with others. So now we see the difference, how health is different from mental health and how mental health is different from mental illness.
So my first question will be, what is the significance of this World Mental Health Day and why do people need to be aware of this day?
As we all know that 10th of October is witnessed or it is celebrated as World Mental Health Day every year. Yeah. It aims, the main aim and objective of this World Mental Health is to spread awareness about the importance, significance and how essential an individual's mental health is for the society, or for, I would say, a better society. Another objective is to spread or to educate people about the stigma attached or the way they are being discriminated. And third objective is to encourage people to support mental health causes and to reach to the lives of the people who are in different parts of the world. Say they are sitting somewhere inside a cafe worrying a lot about their situation, say in Bhubaneswar, Cuttack, Maharashtra, Gorakhpur, Banaras, Mumbai, Delhi, Bangalore, Germany, wherever they are. So we could touch their lives and through this mental health awareness program, we can touch their lives and bring changes so that they are more vocal about their mental health issues.
Right. So ma'am, as we know, people are having a lot of...
So there are a few more things that I wanted to add to this.
Sure.
So Rosaline, as we know that it is for a nation to grow and to thrive, its individual has to be very healthy, और उनका mental health, उनका physical health दोनों equally important and that has to be balanced. And especially after pandemic and war, अभी कल परसों ही हमने पैलेस्टीन और इजराइल के वॉर के बारे में सुना, and then about this Ukraine and Russia war. So you can imagine how grave the situation would be for those who are fighting their mental illnesses and post-traumatic stress disorders. People there, we cannot imagine their situation. So this mental health day, what through this day, 10th of October, we try to bring together all the people in different parts of the world on a common platform and bridge the gap. Those who are seeking professional help, those who are seeking help for their mental illness, and those who are there to render their services to these mental health individuals, mental illness, or the individuals who are suffering from mental illnesses. Mental health is a universal human right. So even I have marked it at so many places. So the main motto is that mental health services and treatment should reach to each and in every individual in every corners of this world.
Right, beautifully said, ma'am. Ma'am, there are some misconceptions that people are actually facing while they hear about this mental health thing. So, what are the misconceptions about this mental health that you want to address on this particular day?
Before we discuss about the myths and misconception, I really want to draw everyone's attention about the fact that not very long ago, we are burdened by the fact that those who were suffering from mental illness were shunned, and they were chained, they were caged, they were buried alive, उनको जिंदा जला दिया जाता था, और it was believed that it is because of the bad deeds, and it is because of some you say daviks जो कहते हैं, और some divine retributions, और कुछ जो बुरी आत्माएं होती हैं उनकी वजह से they are suffering because of their mental illness. But now that things are very different, but still there are 100,000, I would say more than 1,000 myths and misconceptions regarding mental illness. So one very important myth regarding mental illness is that mental illness is uncommon, which is not at all true. Even before the pandemic, this statement was untrue even before pandemic. So you'll be surprised to know that more than 450 million people are affected by mental illness, and WHO in 2001 stated that 1 out of 4 individuals will be suffering from some neurological or mental illness. So you can imagine how grave the situation is, and you'll be surprised to know that during pandemic the depression among adults tripled, and there are around if I'm not wrong, 26.4 crores people suffering from depression post pandemic. So the second myth is that panic disorders are fatal, which is untrue. Those who are suffering from mental illness, they are not capable of doing their work, they cannot contribute. Again, it is untrue. A lot of clients and a lot of people who are coming for counseling in my center, they are some are severely, some are mildly, some are moderately having mental illness issues, but they are contributing, they are performing well, though their journey is little different from other individuals, but they are contributing. Another myth regarding this mental illness is that those who do not have friends and family should only go for counseling and seek counseling. This is very, very untrue, because counseling is done in a very structured environment, and in a very it is a structured therapy. Its aim is to bring change in an individual's life, to empower an individual. It is confidential, it is objective in nature. So this can be not done by speaking or talking to a friend or a family. Another myth is that schizophrenia, we all know the term schizophrenia by now, has split personality, or it has multiple personality disorder, which is not true. Myth regarding eating disorder, that it affects only females, which is totally wrong. Even males are equally if not equally, I would say they are also affected by eating disorder. And it is believed that eating disorder is your lifestyle choices. Means those who are rich, those who are good looking, young, they have eating disorder. This is not at all true. Another myth is that all the people who are suffering from mental illness are violent. No, it is not true. Even the schizophrenic, the people who are suffering from schizophrenia, not all of them are violent. Yes, some of them are violent, but not all of them are violent. Last but not the least, one myth that I really want to address and bring into notice to the audience is that mental illness cannot be treated, which is false. Mental illness can be treated. The journey is different for every individual. The person can go back and lead a very happy and satisfied life after treatment. So this is all about
Amazing.
myths and misconceptions.
Amazing, ma'am. You literally shared that what all misconceptions all we have regarding the mental health thing. So ma'am, just like you said that there are people who are coming to you, they are very productive in their work, but they still have the mental illness. So does this mental health affect physical health as well? Like if we neglect mental health, how is it going to affect our physical health?
Yes, definitely. Our general well-being is greatly impacted and affected by our mental health. If we have a good and sound mental health, it could help in shaping a good physical health and ward off, or I would say fend off other medical conditions. We have heard a lot about anxiety and stress, but I'd like to take the example of depression. Depression, as we all know, that is a mental illness, and a person who is suffering from depression. So what happens in depression is that there are neural pathways. I don't want to go into the whole this brain, and this is not my work. This is all what it is all. This is a work of I would say psychiatrists, and they should elaborate about it. But in a layman term, I would say that there are neural pathways that are affected in depression, and that has impact, and that leads to, I would say, that leads to exhaustion in the body, and that sleeping patterns are disturbed. There are pains and aches in the body. So you could see how it is contributing. Depression, which is a mental illness, is affecting the physical health of individual. In the same manner, one cannot claim to have a sound or excellent mental health if one is suffering from physical ailment like say cancer, diabetes, or heart disease. So both are affecting each other.
So both are interlinked with each other.
Yes, both are affecting. I would say that yes, but yes, it is very true that mental health has a role to play in shaping the physical health of an individual.
Right. So are there, ma'am, any specific symptoms or signs of mental health issues that should people be aware of, and what will be the right time to seek an professional doctor or counselor for this?
Okay, so this is a very beautiful question, and I really want to elaborate by citing example. So when you enter into a counselor's or psychiatrist or psychologist clinic or office, so first thing that they would screen for is their day-to-day lives, their daily basis, how do they perform on daily basis. So they would ask them or someone who is accompanying them, their family members or friend or spouse. So it is found that a person's severity of the symptoms depends on his daily and day-to-day activities. If the symptoms are very severe, it means it will affect his relationship. It will affect his relationship in working environment, in school. His performance will be compromised. But if the symptom is not so severe, it is mild and moderate, then that can be taken care of. So Rosalind's, like, I'd like to give an example. Say that you're working in Ashwini Wellness, all right?
Right.
and you're expecting your performance evaluation sheet or whatever you call it, say after 4 to 5 days. So normally what would be your reaction? You'd be little stressed and anxious about it. Okay, fine, my performance will be evaluated and how I'm going to do. That will be your normal response.
Right.
But what if you're thinking all the day about it? You're thinking कि कैसा होगा, किस तरह से होगा, मु भलो करी मु भलो न करी, मेरा परफॉर्मेंस इवैल्यूएशन ठीक होगा कि नहीं होगा, विल आई बी कंपेयर्ड, एंड यू आर नॉट एबल टू स्लीप, यू आर नॉट एबल टू ईट, you are not able to communicate properly. So there is this whole havoc in your life.
Right.
So then it is something that should be taken care of.
Right.
So this is one example I have cited, and talking about the signs and symptoms. So first sign is there is sudden change in the mood. You are in a very euphoric mood, you are very happy, and suddenly you are dull, sullen and depressed. This is the first symptom. Second symptom I would say is you feel lonely, you don't feel pleasure. Then there is a gap in the memory. There are certain periods, that lost time, I would say, the lost zone. You do not remember that particular. It is no, you are not able to retrieve back from your memory.
Yeah.
What happened? Then your sleeping patterns are surely disturbed. Either you are sleeping too much or you are not at all sleeping. Even if you are sleeping, you feel that you have not got enough, and there is a fatigue. Then there is self-injury or self-harm. You get cuts here, you get cuts on your thighs. These are alarming signs, these are warning signs. And apart from that, the activities which you were finding very pleasurable earlier, you do not find it to be fun anymore. You withdraw yourself from others, from your spouse, from your kids, from your family members, from the social group, or your companion. So there is this sudden change. So these are few signs and symptoms. And then again there is one very important sign is agitated mood. You are very angry, you are very frustrated, and anger is okay, anger is an emotion, but when it exceeds a certain limit, you become aggressive. So you are aggressive. So these are few of the signs and symptoms that we can look for.
So ma'am, what will be some practical self-care tips and strategies one can take or implement and improve their mental health?
See, here I'd like to pinpoint, like we have already talked, and I think we'll be talking a lot more about how to take care. But there are 4 to 5 things that I really want to mention, and first and foremost is adequate sleep. You should have a very good and adequate sleep. You should go for balanced diet. You should eat properly. Mediterranean diet जो बोलते हैं, like colorful vegetables and fruits on your plate, on your platter. Then exercise, meditation. Right. So these are very important daily routines or daily habits that you should follow. Apart from this, you should be working towards your goals. You should be working about, like there is this big goal, so divide that big goal into sub goals. Like you want to do MBA, but you cannot work hard every day, like say I have to get admission into this MBA course, but since you are suffering, you are from mental illness, so make little goals and then congratulate yourself. Accomplish, whenever you accomplish something, then you should treat yourself, you should pamper yourself. So these major goals can be divided into sub goals. Right. And apart from that one thing is social connectedness. You should get connected to yourself, and then you should get connected to people around you, family, friends, peer group, and your girlfriend, and you should suddenly plan a trip, and you should go and just have, say, a cup of coffee or a aloo dum dahi vada. You should enjoy these little things. So these are few things that you should adopt.
So basically people need to understand that the little thing that we think that is very casual, they matters, and that actually if that is making you happy, then you should always have it in your daily life, right?
Yes, very true, very true.
So ma'am, my next question will be, are there any specific group of individuals who are more vulnerable to this mental health challenges, and how can we ensure that they receive adequate support?
Okay, so I personally believe that every individual, everybody is vulnerable. So all I need to say is that almost most of the people are vulnerable, and you do not know what circumstances and what situation will drag you down the drain. But yes, there are minority groups that identify as racial, as ethnic, as gender and sexual, and they are more prone to, they are more subject to poor mental health, and this is especially because they are not getting adequate mental health services, and they are not getting good education. They are not having services reaching to them or accessible to them, and even they are discriminated. There is a social stigma attached against these people. So these are a few of the factors, I think, which are responsible for poor mental health of such people.
Right.
And talking about how could we take care of the situation is by implementing policies like inclusion policies, then anti-discrimination policies, by educating them, and by making gender equity policies. So role of government is very important, and even if there are policies, people are not aware of it, so people should be more aware about their rights, and it should reach to each and every individual.
Right. So I'm talking about the support. How can friends, family members and workplace play a very creating this supportive environment for the individual who are struggling with this mental health issues?
So you'll be very surprised that consciously or unconsciously, even the family members, friends and the care providers, they have this notion that a person who is having mental illness, they not contribute in a meaningful way. So when this is the notion, you can understand how the individual who is suffering from mental illness would respond. They'll feel stigmatized, they'll feel that they are being discriminated. So here we the family members, the care providers, the friends, society, we all have to work as a team, and we have to make sure that some special privileges should be given to these individuals who are suffering from mental illness, especially like in the workplace. They should be allowed to join late and leave early, and when there are night travels, they should be allowed to stay back. And then when there is a financial crunch, they should be given some special aids by the organization. And here the role of the family members is very important. They should be working as a mediator. They should be passing on the information regarding how the person is performing, if his situation is improving or worsening, to their supervisors, to their seniors. So yes, the role of family and friends is very important. We should definitely show compassion, our concern, genuine and positive regards towards these individuals, and they should see this on our face. They should not feel discriminated. They should see that yes, the person who's talking to me, who's showing his concern is genuine, the concern is genuine, and he really cares about it.
Right. So ma'am, talking about friends, when they empathize with the individual. So here alcohol and smoking comes in. So is smoking, drinking or any addiction to any of the substance relieve your stress, or are these like bad habits that actually affect our mental health?
Yes, so people have this notion that when you smoke or when you abuse alcohol, then you get relieved. But the fact is that while when your mental health is compromised, you're more dependent. So this is called emotion focused coping mechanism. You're trying to cope up with your mental illness by consuming a lot of alcohol, by smoking, by consuming cannabis, which is very detrimental to your mental health. Let's say that cannabis, when you use cannabis, in the long run what happens, that you experience more psychotic symptoms, you're nervous, and there are symptoms of nervousness, and you're paranoid, and as I said, psychotic symptoms, you experience psychotic symptoms. And similarly, nicotine, as we know, that play a role in releasing dopamine, which is a chemical that triggers, I would say, pleasant mood. You feel better. So what happens when depression, which is especially related to like very low mood. So when a person is depressed, he's taking cigarettes just to enhance his mood or to get those pleasant moods. But in the long run, what happens? This natural release of dopamine is affected. जो कि brain हमारा naturally release कर रहा था dopamine, वो naturally नहीं हो रहा है. There is inhibition. Then तो फिर क्या होता है कि हम 2 स्मोक कर रहे थे, 4 स्मोक कर रहे थे, and now we have started taking say 10 to 20 cigarettes, 30 cigarettes to get that edge, to get that pleasant mood. But actually you are trapped in this vicious circle. You are caught in this vicious circle of smoking, abusing, and alcohol. So it is very detrimental to your mental health. In no way it is going to help you.
Yeah, so people need to understand it doesn't.
Yes, definitely.
Yeah, okay. So ma'am, many people still feel the stigma surrounding mental health. So how can we work upon this towards reducing the stigma and promoting open conversations about mental health?
See, everybody in this world has a role to play. Every individual in this world has a role to play to have this mentally healthy environment by being more inclusive, by warding off discrimination, by excluding stigma attached to mental illness. So we have to be more supportive and we have to promote mental health. There are various ways we can do it. First and very important point I would like to advocate here is that we should gather a lot of information about mental health and mental illness. We should read newspapers, books, we should seek help from mental health professional, and then we should share all this information with our friends, family, society, companion. Second way of dealing with this stigma and discrimination is by listening to the stories of the person who are experiencing mental illness. So we do not label them and see them as their disease, as their disorder, but see them as an individual. Another way of addressing this stigma would be by not judging the person, by not labeling the person, by not stigmatizing the person, but by accepting that person as he is, with dignity and respect. And we have seen, you must have seen people being referred as psychotic, neurotic. So they should not be labeled as psychotic and neurotic. They should be not referred by their disease but by their names. So the individual's identity, we should not label them as that person suffering from so and so. We can always say that this person has bipolar, this person has schizophrenia, this person has depression, this person has anxiety, rather than calling them psychotic or neurotic. And another way of addressing this issue would be by standing and voicing against those who are giving stereotypical and negative comments about mental illness. You should always stand up. You should always voice against those who are talking ill about mental illness. Last but not the least, you should always share your own journey, your own experiences if you are suffering from some mental illness.
Finally, take home message for those who might be struggling with their mental health, and what advice or resources would you recommend to those who are seeking out?
So as we have discussed, and again I want to mention that there are various options available for support, and some are more suited for you and more accessible. And there is no, I just want to pinpoint, I really want to tell each and every individual who is listening that there are no wrong ways of taking care of your mental illness. What works for you might not work for other people. So different things at different times work differently in different situations. So what is working for you may not work for me. What is working for him may not work for other person, say for the third person. And apart from this, you should always go and seek help from your general practitioner, from certified therapist, social support group, your friends, peer group, family, community services. Online counseling services are also available, so you can always go and seek help. And I know it's very difficult to come out from this zone to seek help, but you have to always remember that you are not alone in this journey, and there is always someone to wipe your tears and bring smile on your face. There are a number of people which you are not even aware of, who will be really willing to pull you out of this grave situation. So always remember, not just visiting mental health professional is important, but taking care of your daily or day-to-day activities is important. What makes you more happy is more important. So apart from visiting mental health professionals and institutions, you should always remember that what makes you more happy or a happier person. So you should always keep in mind that. And apart from that, there is this message for the youth, and especially for the school community, that please be vocal about mental illness. Please communicate openly. This is for the authorities, school authority. Please communicate openly and tell every student of your school that it is okay to talk about your mental illness. It is okay to seek professional services. It is not shame to come out and ask for help. And yes, there is a hope, there is a future once your mental illness is diagnosed. So this is especially for the authorities, school authorities. They should communicate this clearly and openly to each and every student.
Yes.
And apart from that, there is one mantra that I tell all my clients, which goes like this: I want to do it, I can do it, I know it is difficult, but I will do it. So when you speak this internal dialogue to yourself, so when you're repeating these internal dialogues, your brain is actually welcoming these internal dialogues. You keep on repeating. You could have just notes. You could just put it inside your bag, on your walls. You can write it down. I want to do it, I can do it, I know it is difficult, but I will do it. like flashcards.
Yes.
You can put inside your bag, in your cupboard, on your walls, and always instruct yourself that yes, the journey is not smooth, but eventually we will overcome this situation. Apart from that there is one thing that I really want to mention is that the right to life with dignity, that says that love yourself, accept yourself and respect yourself. You are yourself, you are unique. You need not to compare yourself with others.
Yes. So basically it's like you are the only person who can love yourself more than anyone else in this
Yes,
world.
very true.
So you can be your favorite, just like Kareena Kapoor said that
Yes.
मैं अपनी favorite
Yes,
हूँ.
yes, very true, very
So
true.
that is like the real mantra of real life.
Yes.
Yeah. Thank you so much, ma'am, for coming into the show and giving suggestions to youth and also us. And I really hope that after this, people will not consider mental health as a taboo, and people will more often talk and can ask help for this without any shame.
Thank you so much.
So before summing the entire show, I want to address that start prioritizing your mental health. Find valuable time for yourself first. Spend valuable time with your loved ones, your close persons, and with the right people who have positive mindsets. Start spending time doing yoga and meditations. Sleep at least 8 to 10 hours. Stop drinking and smoking and try to avoid it as much as possible. And the most simple mantra is do not keep anything inside you. Just burst it out. Talk to someone about it. And the most important thing is if you feel like you are in tension, stress, depression, nervous, or you don't feel good enough to be yourself, talk to a mental specialist and have a proper consultation. So let's just wrap the entire show today. Thank you so much for watching, and to get more updated health related topics, don't forget to subscribe our channels. Thank you. Bye bye.
दर्शक बंधु बिना अपॉइंटमेंट रे सबु रोगर सफल उपचार जानिबा पई हेले एबे ही सब्सक्राइब करंतु हमर YouTube चैनल प्रिकॉशन फॉर हेल्थ आ बेल आइकन क्लिक कला फल रे आपण हेल्थ रिलेटेड वीडियो सहित रहिबे अपडेट।